For the purpose of this demonstration, we're going to be using YUCK germ simulation lotion. We're going to apply the lotion to the caregiver's hands as we would any hand lotion or cream. On the fronts, on the backs, between the fingers, around the fingernails, and the wrists. The magic of YUCK germ simulation lotion is that once applied to the hands, it becomes invisible under ordinary light, but under UV light, it will glow bright white. That allows us to look at not only where the washing has been done well, but more importantly, where the washing has missed important spots in the hand. And now we're going to demonstrate a standard 20-second hand wash. First, they wet their hands with water. They both apply an equal dollop of soap, and they lather their hands, palms and back of hands, around the wrists. Fingernail claw action, first in one hand, then on the other hand. Between the fingers, both palm and back, around thumbs and forefingers. They then rinse thoroughly with running water, and then dry thoroughly with a paper towel. Paper towel drying is a critical step in hand washing as the friction and absorbency of the paper removes over 40% of the pathogens. Now let's look at the effect of a 20-second hand wash. You can see these hands are much cleaner. Under the nails, a little bit, around the nails, hardly nothing. Palms are clean, back of hands are clean. These hands are care ready, ready for patients, ready for healthcare environments. Let's take a look at these caregiver hands after a 20-second hand wash, and again using YUCK germ simulation lotion to disclose where the wash wasn't as well done as it could have been. You can see around the fingernails there's still some glowing white spots. Not bad under the fingers, but certainly around the fingers, and on the wrist there are still some missed areas. And of course that ring, those wedding rings you ladies wear, are hard to get clean. These hands not quite ready for patients at this stage, but we'll show you what to do next in terms of achieving care-ready hands. As you can see, not every caregiver will achieve the same level of clean in a 20-second hand wash. That's why we advocate the use of a hand sanitizer in high-risk situations. Situations like the first entry to work, when they've just used the restroom, or when they're dealing with a high-risk patient, or after dealing with a high-risk patient to prevent cross-contamination. Simple hand sanitizing focused on the areas that they have trouble washing with a hand wash, as demonstrated in using the UV light, will move that 3-log kill from a normal hand washing up to 5 or 6 log, generating care-ready hands, ready for the patient, safe for use in a healthcare environment. An effective tool that we've developed for setting a standard for the quality of hand wash and for testing each employee against that standard is this ProGrade scorecard. ProGrade allows you to visualize the standard for your hand hygiene compliance. It also allows you to test each employee in terms of their ability to achieve that standard. It's a simple graphic, a simple scoring system, but most importantly what this does is it visualizes the standard and it personalizes it for each individual employee. They know their score after using this technique. They know where they have trouble washing their hands, and they know what they have to do, whether it's sanitizing or nail brush or gloving, to achieve a care-ready hand.